Hello, everyone. My name is Susan Gunderson, and it's my privilege to serve as Chief Executive Officer of LifeSource, leading an amazing team of individuals who day in and day out work to save lives through organ, eye, and tissue donation. I'm coming to you during week 3 of Minnesota's Shelter-in-Place program with an update about our activities during these challenging times. First of all, I'd like to thank our frontline workers who are day in and day out working to keep us safe so we can shelter at home. Our grocery store clerks, our truck drivers, our farmers, our police officers, our first responders. They're there to protect us, to make sure our needs are met. We're thankful for your service. I'd also like to extend a special thanks and gratitude to our hospital and healthcare partners, doctors, nurses, respiratory therapists, and so many others who are working so hard during these challenging times under difficult situations to serve the growing number of patients affected by COVID-19. We are thinking of you. We are walking side by side with you to lend our support, and we are incredibly grateful for your dedication in these challenging times. Thank you. So how is COVID-19 affecting LifeSource? Like so many other organizations, we are experiencing a variety of challenges due to the pandemic, but our work must continue. Our team is actively monitoring the challenging environment, adjusting our practices and guidelines, connecting with our transplant centers, donor hospital partners, tissue processors, government officials, transportation suppliers, partners, and so many more as we navigate these new waters. We have an amazing team at LifeSource who work every day under all conditions, side by side with the hospital and transplant teams to fulfill the promise of healing through donation. I have so much respect and gratitude to my passionate and dedicated team for your unflagging presence and support. Thank you, thank you, thank you. We continue to do all we can to keep operating in ways that protect our teams, that protect the patients and the families we serve, and that provide hope to all those who, even amidst this pandemic, are waiting for a life-saving transplant. Think about this. More than 1,300 people have died since January waiting for a transplant, and more than 110,000 continue to wait for a new heart or kidney, liver or lungs. Even in the midst of such challenging times, we are inspired by the grace and compassion of families who choose to say yes to donation while suffering such sadness in their own families' lives. Together, our work is now more important than ever. Our mission to save and heal lives must continue. Here are simple ways you can help during this epidemic. Number 1, register to be a donor. It's a simple action with a big impact. You can offer hope in this darkness for the others who are waiting for a second chance. Did you know you can register online? It's really easy. Visit our website and click the big orange Register Online button. Number 2, practice your sewing skills. Our funeral home partners are in dire need of homemade face masks throughout Minnesota, North Dakota, and South Dakota. Last week, our partner support liaison, Kelly Romanowski, began sewing masks with her daughter as part of a service project. Word got around. Shortly after, several of our team members stepped up to help, and thus we now have a mask drive underway. Visit our blog site for more information on how to get involved in this project. And number 3, I want to remind all of us that April is Donate Life Month. And this year, instead of having in-person events across the region, we are celebrating virtually through a 30-day challenge, an online challenge that we're calling #ShareYourHeart. I'd invite you to get involved in that project as well and inspire others to register as organ, eye, and tissue donors. So we are in challenging times, but together we are stronger, and together we will get through this. Thank you for your tireless support. I'm very grateful. Stay safe and be well. Thank you.